This is the second part of the overview on measurement and instrumentation, particularly with examples from carrying instruments. So remember that we're talking about total scores on a construct or concept with the first part of this series, and essentially we're looking at how you calculate total scores from test items. There might be rules and weighting for each subscale, for example. The items have to be precise, succinct, and essentially reflect the concept or domain of the content, carefully figured out in terms of how the investigator crafts them, and essentially minimizing the errors of measurement so that the reliability of the test scores increase. So when you're looking at instrument readability, there is an easy way for you to calculate that if you have Microsoft Word. If you in fact look at the area under review, you can install, if you put your clicker on File in Word, go to Options, Proofing, and check on Show Reliability Statistics. So some examples here: the Caring Behaviors Inventory for Elders has a 4.5 Flesch Kincaid grade level, including the directions, all items, and the demographic profile. That's important because it was administered to different people, both older people and also those persons that took care of them. And that was it was not an acute care sample, by the way. And then you can also look at the fact that the Caring Behaviors Assessment is at a 6th grade level, so the investigators reported that. Response rate is always important when you're talking about instrumentation. You might aim for a certain sample size and end up with less. So then you report that, and sometimes there may be problems with the instrument and the scaled items that you're using. The person who completes it might not have an opinion or knowledge of the subject. There are a lot of ways for you to get better response rates if you're mailing, if you're using email and Qualtrics or SurveyMonkey. There are ways to remind people. Postcards still might be used from some people, but a lot of times people are eliciting responses through the internet and Qualtrics or SurveyMonkey. Overall description is very important when you're writing about an instrument that's being developed. The full name, the acronym, the author and the creator, what the construct that is being measured is, conceptual definition, and basically how the scores on the instrument generate the operational definition of it. How many items? How each of the items are scaled? What type are they? Visual analog scale, checklist, Likert scale, Q sort, and that gets you into levels of data. Do you sub the ordinal items? How do you handle the data? Do you get mean scores? If in fact you're using someone else's instrument and you've gotten permission to do so, what have been the data that have been reported on reliability and validity procedures, and how you're going to establish or reestablish them in your particular sample? How long does it take to complete the instrument in relation to the participants and for you to administer it, and who in fact is completing the instrument? Caring Behaviors Inventory 42, obviously there are more versions of this, but this is just the initial Chromebox Alpha. But here you have all of the subscales, which are parts, subconcepts, or factors or domains of an instrument, with the items identified and the Chromebox Alpha, and also the definitions for the subscales. So you see that. Here are a list of different instruments that measure nurse caring. There are a number of them in this slide, and also you'll see additional ones on this slide, and finally on this slide in terms of what is out there. So there's a lot that's been done when you think about that. Gene Watson and Kathy Sitzman are conducting another book. They're going to create another book on assessing and measuring caring in nursing and health sciences. So this will then be an old jacket for us to look at. It's a 2nd edition. The 3rd edition's in process. And these slides were developed for the Ann Boykin Institute.